Well, now I'm going to, with the closing remarks, I will try to just to summarize the things that maybe were most important. I write the conclusions before the event, so maybe some maybe change a little now. Please, I don't have the. Who has? It's here. Okay. Okay, so we can go to the first conclusion. We know that celiac disease and intolerance to gluten it's really an important issue for the public health, and so if the beer makers are able to produce a gluten-free beer, could be an important for the society. According to the fiber, we think also that the beer makers have to improve the way to increase the fiber in the beer and also the type of the fiber, and then we increase the health benefits at least of some beers. And in polyphenols, we have learned that is really very important for health, as also ethanol, but polyphenols plays a key role in the protection against cardiovascular disease, cancer, and maybe infectious disease, etc. So polyphenols in beer may help to lower the risk of cardiovascular disease, maybe the most important conclusion on Professor Lamuela. In the other, you can say that the difference in health outcomes observed between beer and drinkers and other alcohol users may be explained by other socio-demographic and lifestyle factors. So alcoholic beverage preference seems not to be independent related to diet. So we think that it's really important to improve our diet and also to drink moderately, maybe beer and wine, and this maybe we can get there the best benefit for our health. In other things, we have seen that moderate beer intake is associated with higher adherence to traditional Mediterranean diet in Sicily. We know also in Spain, though the idea that only wine is the beverage typical of Mediterranean diet maybe have to change and include beer in the pyramid. We have learned from the researchers from Great Britain and from Romania that this is not, it's a false, the beer belly does not really exist. It depends absolutely of the amount of beer you drink and also of the type of diet you follow. So we have to change this idea that if you drink beer, you will be to increase your body fat. And in the last session, that there is evidence for the G-shape association between wine or beer intake and cardiovascular risk. So continues to be update the idea that is a G-shape on alcoholic, the relationship between alcoholic beverages and cardiovascular disease and also overall mortality. And the daily amount of 25 grams of alcohol of either wine or beer appears to be the maximal protected from the risk of suffering a cardiovascular event. So we have to maintain always a moderate intake if you want to be in the right side of the coin. We have learned also that the consumption of beer, both with and without alcohol, exert a very impressive cardioprotective effects against the detrimental effects of dyslipidemia on ischemic myocardium. And the last speaker told us the importance of polyphenols present in several foods, including non-alcoholic beer, has a strong antioxidant, antipathogenic, anti-inflammatory properties that can be used for the runners and the people who export in order to reduce the bad consequences of a high physical activity. That's all. So I am really happy of the results of this symposium.